part 3 of 3. And on this section we're going to focus on the control of reproduction, birth control methods, it's an ancient art I think, or non-art, infertility, assisted reproductive technologies, and of course we'll have to look at sexually transmitted diseases, those STDs as they're called, that are caused by viruses, and those that are caused by bacteria, and also about vaginal infections. So the most reliable method of birth control, that is preventing impregnation or fertilization, is to not engage in sexual intercourse. This is also called abstinence. This form of birth control has the added advantage of preventing transmission of sexually transmitted diseases. So the textbook goes in and shows all the different common birth control methods that have been, well, not all of them, but common ones, in table 16.4. And when we look at the table of method, look at the method, then look at the column on effectiveness, like what percentage of the time does it work, and then look at the health risks that are associated with these different types of methods. So, for example, what's the trade-off for effectiveness and health risk for the intrauterine device? And what is the trade-off for effectiveness and the health risk for male and female condoms? So this is a very busy list here, but if you take a look at over here in the effectiveness column, there's only one here that says 100%, and that's that abstinence, where you do not have sexual intercourse, and it also protects against sexually transmitted diseases. Well, we asked the question about intrauterine devices. If you go down to the bottom here, this is the name of the contraceptive method. This has a 99% effectiveness rate. However, look at the payoff, or the other side of health risks: cramps, bleeding, infertility, perforation of the uterus. This is obviously not something that people will want. And we look up here, male condom and the female condom. There's no protection against STDs with naturally material condoms. There might be some latex allergies, but look at the effectiveness rate, only 89% for male condoms and even lower for female condoms. So anyways, you can take a look at all of these and see what the health risk is, what the effectiveness is, and what the procedure. There's also surgical methods of birth control, and that would be a vasectomy in men and tubal ligations in women. So in the vasectomy, with vas deferens, that's that long tube that comes up and goes around the bladder, it's actually cut, and then the cut ends are tied or sealed. And the tubular ligation, this is the uterine, those are the fallopian tubes, are cut and tied or cauterized or sealed off in that way. So you can see that on illustration on figure 16.15. By the way, vasectomies are 99.8% effective. However, some sperm remains in the vas deferens, because we talked about that earlier in this chapter, how it can store some sperm in that area as well. So some may remain after surgery. So it is possible to create fertilization after almost up to 2 months after vasectomy surgery is performed. And this is the illustration in your book. Again, This is the vas deferens that comes here. This is the sperm production down here. So sperm's coming up here, and they cut and tie this off, but sperm can still be here, and it's possible for pregnancy to still occur up to 2 months after a vasectomy. And over here, illustration is the uterine tubes, oviducts, or fallopian tubes, and they have been cut and tied so that egg cannot come down the tube and be fertilized from the sperm. So then we have another problem, which is too fertile, so people try to prevent pregnancy. Then we have another problem where not fertile enough, people cannot get pregnant. So what is the cause of this infertility in males? The most common cause in males is a low sperm count and or a large proportion of abnormal sperm. In other words, they can't function. Now, the reason for this is thought it could be due to environmental factors. There's some suggestion about some pollutants that might cause this low sperm count or abnormal sperm. But it's also been pointed that a sedentary, this is like couch potato lifestyle, and smoking and alcohol consumption, they point to most often a cause for male infertility. And they note that if males spend most of their day sitting, using a computer or watching TV, the testes, the temperature becomes too high for adequate sperm production. Now, in the female, what is the cause for infertility in females? Well, obviously there's a lot of different reasons, but being overweight seems to be the most significant factor for female infertility. Now, they note that it's kind of ironic that in normal weight women, the fat cells in the body produce a hormone called leptin. And leptin actually stimulates the hypothalamus to release the hormone that affects the anterior pituitary to produce the follicle stimulating hormone, and then you have normal follicle, in this case the egg development that follows. Ironically, in overweight women, leptin levels are very high and impact, and if they have a bad influence or whatever affecting that system. So the ovaries of overweight women, the result has many small follicles that fail to ovulate. So somehow this leptin levels are just not, they're just not in the normal range for basic follicle development. There's other causes for infertility in women. Sometimes there's a blocked uterine tube that could be due to previous pelvic inflammatory disease, and then there's also problems with endometriosis. This is the presence of uterine tissue that is so again, the other causes for infertility could be that blocked uterine tube from inflammatory disease, or this thing called endometriosis. This is the presence of uterine tissue that's found outside of the uterus and causing problems. There are assisted reproductive type technologies that you can read about in your textbook. The most common one that people are most familiar with is artificial insemination. There's also an in vitro fertilization, and they're using ultrasound now to detect immature eggs, and then they're brought into glassware by using a needle, and then the immature eggs are brought to maturity while outside of the woman's body, and then concentrated sperm are added to it for fertilization. Then after about 2 to 4 days of the embryo, after the zygote starts developing, it's ready to be transferred back into the woman's uterus for to continue the pregnancy. Now we're going to go back over and talk about sexually transmitted diseases. There are different types caused by different organisms, by viruses or bacteria. So right now we're going to focus on the STDs, meaning sexually transmitted disease caused by viruses. First is human immunodeficiency virus. Most people call it just HIV infection. Genital warts is caused by a virus. Genital herpes and hepatitis is also caused by viruses. In HIV, the virus actually targets the T helper cells and some macrophages in the body. And if we do recall from our immune system, the T helper cells actually stimulate some of our innate immune responses. So you can imagine that if you don't have T helper cells stimulating your immune response, these cells cause the immune system to be severely impaired. In other words, they can't function. And then that way, the diseases that normally the body would fight off, and you'd never even know they were present, now it's not able to. So it's given this name, these opportunistic infections, because they have an opportunity now because the immune system is down. So that's why they call them opportunistic infections. Genital warts are caused by the human papilloma virus, or HPV. It usually, the carriers, either the people who have this either do not have any sign of the warts, or they may be just very flat lesions. So in other words, it can be transmitted without people knowing about it. So, but when they are present, they're commonly seen on the penis and the foreskin of men, and also commonly seen near the vaginal opening in women. And genital warts are associated with cancer of the cervix in women. And then actually HPV, human papillomavirus, may be involved, they think, up to 90% of all cases of cervical cancer. Genital herpes, also caused by a virus. It's caused by a virus called herpes simplex virus type 2. Type 2 is mostly associated with genital herpes. And then of course we have a herpes simplex virus type 1 that most people have had, that's associated with cold sores on the face, on the lips, or fever blisters. And so sort of the rule of thumb here is if the herpes simplex virus is above the waist, it's usually a type 1. If it's below the waist, it's usually type 2. So in the case of the type 2, there's the blisters that appear, and you can see this illustrated, or photographs of this, on page, it's figure 16.18. And once these blisters rupture, they leave a painful ulcer. So the symptoms can include painful urination, and in women, a very intense discharge from the vagina. And after the ulcers heal, the blisters can reoccur because the disease is still present. So I want you to take a look on page, I'll get the right page here. It's actually 381. This should not be 38. It's page 381, figure 16.18. These are exact photographs of genital herpes. So when the ulcers heal, the disease is still present, so the blisters can occur at different times. Now, if the infant or the newborn fluid coming through the birth canal is exposed to this herpes, it can actually cause infection in the newborn. And that infection, this genital herpes exposure, can actually lead to neurologic disorders and even actually fetal death, or newborn baby. Then another virus is the hepatitis. Hepatitis is infecting involving the liver. It can cause liver failure, liver cancer, and even death. And there's 6 known viruses that cause hepatitis, and they're cleverly named A, B, C, D, E, they forgot F, and G. So hepatitis A can be contracted by drinking water that's contaminated by sewage. It also can be contracted from oral anal contact. Hepatitis B can be contracted through sexual contact and by blood-borne transmission like transfusions or needle sharing, that sort of thing. Hepatitis C is most cases are from transfusions. Hepatitis D is also sexually transmitted. Hepatitis E is transmitted from contaminated water, and hepatitis G is also sexually transmitted. Well, when we move over and look at the sexually transmitted diseases caused by bacteria, there's it's only those sexually transmitted diseases that are caused by bacteria that can be cured with antibiotics. However, after saying that, there are some bacteria that are starting to become resistant to antibiotics. But chlamydia is one of the STDs caused by bacteria, and the symptoms are usually mild or no symptoms, in other words asymptomatic, especially for women. For men, there's symptoms about 18 or 21 days after an infection. They may experience mild burning with urination and a mucus discharge. Women may also have a vaginal discharge with a urinary tract infection. Chlamydia also causes cervical ulcerations and pelvic inflammatory disease. Then another sexually transmitted disease is gonorrhea. Symptoms in men is pain with urination and a very thick greenish yellow discharge. Symptoms in women are different. This latent infection can lead to pelvic inflammatory disease. It actually can damage the uterus and the ovaries. And if a baby is exposed during birth to the gonorrhea infection in the woman, eye infections can then lead to blindness in the baby. This is why all newborns are given eye drops at birth to prevent this. Gonorrhea can also spread to other parts of the body, causing heart damage or even arthritis. And gonorrhea, they note, is becoming resistant to some antibiotics. And then there's syphilis. Syphilis is also has different stages. There's primary, secondary, tertiary means just third stage. So the primary stage, there's a sore, an ulcer with hard edges that appear. It usually goes away or heals spontaneously. Doesn't mean the infection's gone away, just the ulcerated sore has. The secondary stage is a breakout in a rash that does not itch. It can be even seen on the palms and the hands and soles of the feet. The third, tertiary stage, lasts until the person dies. This is time it can affect the cardiovascular system by causing aneurysms, particularly in the aorta. Or it can affect the nervous system, causing psychological disturbances. Or it can also create large ulcer, can be developed on the skin or in the internal organs. There's also a congenital syphilis. This is a bacteria that actually crosses the placenta during pregnancy, and the child is then born blind or with many anatomical malformations. Then lastly is the vaginal infections. Now, all the vaginal infections, term is used, it's called vaginitis, meaning infection of the vagina. The larger, more common one is called a bacterial vaginosis, or BV. It's thought to be responsible for almost up to half or 50% of the cases of vaginitis in the United States. An overgrowth of this infection can occur for non-sexual reasons. Men without symptoms of this bacteria can pass it on to women who do have experienced symptoms. In other words, men may not have symptoms, they can pass it on, the women do get symptoms. The symptoms are vaginal discharge with a strong odor, a burning sensation during urination, and or itching or pain in the vulva area. There's two other causes of vaginal infections. One's a yeast, Candida albicans. It's a normal yeast. It's found in the vagina. It's normally found, but certain circumstances can cause an overgrowth. So too many antibiotic use, even women taking birth control can sometimes have this overgrowth of yeast. And so it can cause these infections. The symptoms are thick, white, curd-like, they call it, vaginal discharge, and itching in the vulva or vaginal area. Another type of infection is a protozoan. It's Trichomona vaginalis. This can affect males and females. In the males, the urethra is the usual site of infection. There are usually no symptoms and can pass on the parasite to their sexual partner. In females, the symptoms are a yellow-green, foul-smelling discharge and itching of the vulva or the vagina. So that ends the reproductive system, part 3 of 3. Where we reviewed the control of reproductive methods, birth control methods, infertility, assisted reproductive technologies, sexually transmitted diseases, STDs caused by viruses and those caused by bacteria, and finally vaginal infections.